All right, I'm Van Reed. I'm the Director of Emergency Preparedness for St. Landry Parish. We were notified about an hour ago that St. Landry Parish does have its first positive for the coronavirus. I'm going to let Dr. Tina Stefanski with the Department of Health come up and address that.
Hey, good morning. Excuse me. So, yes, we received a notification earlier this morning that we had an individual from St. Landry Parish who tested positive for coronavirus 19, for COVID-19. I just want to say that St. Landry Parish has been preparing. This is not unexpected. We expect more cases, not only in this parish, but throughout Acadiana, especially as we have really hundreds of commercial lab tests that are outstanding. So again, we expect that we'll have additional cases here in Acadiana. Again, this is the first case, however, confirmed for St. Landry Parish. So we're here today just to answer some questions and help, assure the residents of this parish that, again, they're parish officials. You'll see we have Senator Boudreaux, Representative Miller here. You have a hospital, a few hospitals here in this parish who have been actively engaged in working with us, as have your parish officials, to prepare this parish. So nothing has changed today. Again, we expect this. We expect the numbers to increase statewide and nationally as these commercial lab results, again, not just for here in Acadiana, but statewide and nationally, continue to come in. So, we won't release any more information other than the individual is a resident of St. Landry Parish. As part of our case investigations, we notify those individuals, we notify their healthcare providers, and I can assure you that this individual has been extremely responsible, has been, following isolation precautions, and I have no concerns regarding that. Again, a very, very responsible. Our epidemiologist, as soon as we get notified, or on the phone and conducting these case investigations within a matter of minutes. So we're very fortunate to have a great public health team and parish officials here in St. Landry Parish and in Acadiana. I do want to mention a few things that were actually released in a Centers for Disease Control and MMWR article yesterday about this illness that you might be hearing more about through the national media. So we know that severe illness leading to hospitalization can occur with adults at any age. So while we know more serious illness, the mortality rate in particular is higher in individuals 80 and older. Serious illness leading to hospitalization is higher in individuals 60 and older, but there are cases in the United States, and those numbers are now being released, where we have younger adults who have had serious illness and have been hospitalized. However, individuals less than 19 years of age do appear to have the mildest illness. So just wanted to clarify that again, the risk for serious illness and hospitalization increases with age, but we know now that adults at any age in the United States have been hospitalized and have severe illness. So hopefully that will further strengthen the message for the importance of social distancing. So while healthcare, parish and state officials are doing what we can to share messages and prepare in advance, what the community can do is to understand that there is a lot we don't know about this virus. It is new. It was just identified in early January. So what you need to do is follow the guidance of health officials, parish officials, state officials, and stay home when you can. If you must work, if you can't telework, then you need to keep your work environment clean. People need to practice social distancing, as you see us doing here today, and just try to avoid the further spread of this virus in our community. That's what we need to do now. If we don't do that and we don't do it well and responsibly, then what will happen is that we will overwhelm the healthcare system in this parish, in this state, and in this country over the next couple of weeks. And so if we don't act now, we will see a snowball effect in a couple of weeks. So we ask everyone, practice social distancing, stay home. Remember that your actions impact those elderly, those older individuals, people with underlying health problems who are more likely to have serious illness, disability, and death. And that's people with hypertension, with heart disease, with lung problems, with diabetes, and with cancer. So those are the best studies that we have coming out of China and the United States, is that those individuals are most at risk, and we still don't know the role of asymptomatic spread. So what we need to tell people is we don't know enough about this virus, but what we do know is that in past pandemics, and what happened in China and South Korea, is that when people strictly follow these social distancing and isolation precautions, we see a decrease in the spread of virus and better outcomes. So that's it for me. I don't know if our state officials want to make any comments.
The parish government is open. Our parish offices and agencies are closed to the public. However, if you do need to reach an agency, we do encourage you to telephone the office, and someone there will respond to your needs. These are steps that we've taken to prevent the spread. We are continuing to explore options on how we can keep St. Landry Parish citizens safe. With that, I'll bring up Representative Dustin Miller from District 40.
Good morning. As everyone, not everybody can see, but we have many mayors and chiefs and different parish leaders here today. Just so the public know, we're in calls every day as leaders and talking about what's best for our citizens and what action we need to take. Like Dr. Stefanski said, this individual has been quarantined. It's following all protocols. His or her healthcare provider have been notified. I just think it's very important that we try not to panic. If anyone have any symptoms, please contact your healthcare provider, because many of those are now going to telehealth services or FaceTime, Skypes, different type of Zoom activities, so that you don't have to go into their office and possibly acquire or give this virus to someone else. So I think it's just important that we minimize our social activity and really follow the government lead on social distancing. This is our first case. There is a lot of tests throughout Acadiana that have been sent off that we're still awaiting results. I think on average it's taken 7 to 10 days, maybe more. So just please continue to practice social distances and only leave your house if you need.
Senator Boudreaux will be next.
Thank you, and good morning again. Just real quick, I think there's a lot of anxiety, a lot of fear in the community. I want to thank the media for your role. Representative Miller recognized we have mayors and from all of some of the small towns in St. Landry Parish, and the sheriff is here with us. One of the things that I just wanted to express in working with Dr. Stefanski and with the governor's office and with all of our municipalities is we want to release some of the fear, and you guys are vital to that role. And we're in touch, Representative Miller and I are in touch with the governor and his team, so that people will understand when we say don't try to buy groceries for a month. We want to take every precaution necessary so that you're comfortable that no one's going to close every store where you won't have access to fill a prescription or get groceries. So we're not going to use words that scare people, and I think that's one of the most important things that we can emphasize moving forward is you can't say one thing. Words have meaning, and we can't say we're going to quarantine everybody or we're going to self-contain. When we get to those levels, everybody will know in advance. We're communicating that, and we're asking you to assist us with that. But if we follow the precautions that Dr. Stefanski and all of the people throughout the state are doing, we're going to be in a better place to flatten that curve. So thank you all for being here, and for all of the healthcare professionals that are out there working on behalf of all of us. We appreciate your service.
So Dr. Tina has one more thing to say.
Yes, and Senator Boudreaux just reminded me, we don't want people to panic. That's not what we're trying to do. It's flattening the curve. You hear that? That's what we're trying to do. And so our actions that we take today really help to impact us in the weeks and months to come. And so that's really the message. That's really the reason, I guess, for that stern message, asking people to really, practice these recommendations that are being shared. So again, we see a decreased level of virus in this community, and we don't end up with an overburdened healthcare system. That's what we're all working so hard to avoid. But I think it concerns people when we see individuals gathering or doing things that really aren't necessary. The message is try to keep your circle of family and friends small. Younger people, offer to help older people, offer to go to the grocery store for them. We want people to go to the grocery store. Again, just as the governor said so well yesterday, and Senator Boudreaux, don't stock up, don't hoard groceries. Things are, take your time, grocery shop, do all those things that you need to do. Help those, however, that may be more at risk for serious illness. Offer to do those things for them and help take care of your neighbor. And again, just practice good hand hygiene. So when you do go to the grocery store, if you do go to work, keep your environment around you safe. Keep your hands clean. The way we spread infection is by hands that are not, that may be dirty, have germs, and then you touch your eyes, your nose, or your mouth with hands that are not clean. Or you get too close to people and they cough or sneeze on you. So those are just very practical ways that we can reduce the spread of infection. It's not complicated, it's very simple. So we just ask people to again do what you need to do, but practice those good or keep those good practices in mind when you are going about your activities throughout the day. And again, take care of your neighbor and people who are older and who maybe shouldn't be going out and about in the community. And again, help them when you can. Thanks.
Thank you, Doctor. And now Sheriff Bobby Guidrose.
Good morning. Thank you for being here. I just want to tell you that I received information this morning that a local bar on the east end of the parish is in defiance of the governor's proclamation, and I've already began remedies to that. I've attempted to contact the owners. He has not called me back, but I can assure you he will close. The proper action will be taken if he refuses. I'm told that his comments were that Congress said that they can stay open. He must have read Facebook or something, and that's not so. And I reminded him in a phone message to him in a voicemail that Congress doesn't run this show in St. Landry Parish. So we're going to insist that they follow the governor's proclamation. It's for all our good. And I'll keep you posted, though, if anything further happens. Our patrol division is on day and night watch. If they see businesses open that should not be, we'll kindly ask them to shut it down. If it's a bar, we'll have a little more resistance, I'm sure, but we have the manpower and the resources to handle that. So we have the patrol division watching for us. So I urge the public, contact my office if you know of any business that's in violation. We will kindly go out and remind them of what the proclamation says, and they must be in compliance with that. So with that, I say thank you.
Mayor Julius Alcindor from Alcindor from Opelousas.
Good afternoon. Thank you all for being here, and I'm just going to echo what's been stated before by those who spoke before me. Is that, look, we're all working together. All the stakeholders, the shareholders are here together, doing the best that we can for the people that we serve each and every day. The parish, myself, and the representative and the hospital, we're together speaking every day. As the chairman of the St. Landry Parish Municipal Association, I'm always speaking with our mayors. We have some here today. We also, as Dustin mentioned earlier, we have the chief of police here. So we are steadily in contact with each other, conveying our thoughts and our messages and what we need to put forward to serve the people that we serve each and every day. And as we continue to move forward, I'm going to echo the same what Dr. Stefanski said and everyone else. Practice good common sense measures. Hand washing, social distancing. And more importantly, if we continue to do what we need to do on the front, we're going to minimize that hill on the backside. But again, it's going to take all of us and the news media to put out that factual information and follow the guidelines, as everyone has said, from the CDC down to the local LDH and the local authorities. But again, as we continue to move forward and we meet, more information is forthcoming. God continue to bless each of you and all of us here in the United States.
And Mr. Bill Roedier, Director of St. Landry Parish Economic Development.
Hey, good morning, everyone. And again, I'll echo thank you for all being here on short notice this morning. A couple things that I'd like to reach out to and convey the message to our business leaders in this area, in this region, and even to a certain extent in Louisiana. As we all know, these are unprecedented times, uncharted waters in some ways. Our role largely is to be the bridge between the business community and the government community, and you can see the type of collaboration and communication that we put together on behalf of the government leaders. What I would like to encourage business leaders as you look forward to challenges and opportunities is to use us as a resource. Monitor the types of available assistance that will be available to you as a business on opportunitystlandry.com, COVID-19 resources. We're constantly updating federal resources that are available, state resources that are available, as well as local resources that we're trying to put together to be available for you as a business leader. There's a survey on there now. If you are a business leader in this area, I ask that you go on there. It went live at 9 o'clock this morning. We're trying to understand your needs and the effect of this so we can communicate this through our regional, state, and federal partners so that effective programs could be brought to bear as soon as possible to help you as businesses with the effects of, and to your employees. For your employees can file for their unemployment claims on a link with opportunitystlandry.com, which will go directly to the Louisiana Workforce Commission. You can file online at laworks.com, or you can go 866-783-5567. There's continuing updates on unemployment resources that are available for your employees. I encourage you as employers to keep a close monitor on that so you can effectively communicate to your people. This is going to be a time of challenge, but maybe opportunity for some of our businesses as we reach out across America to provide their resources to people across this country. If you have exceptional circumstances or if you have questions, please reach out to us directly. If there are circumstances that we need to work with you to make sure you understand what's available, that's what we're here for. So I would encourage you, opportunitystlandry.com, and anything that you need additional assistance as a business leader, that's what we're here for, is to make that connection with the government community. Again, thank you so much for all being here this morning.
And Chief McClendon with Opelousas Police Department.
Again, thank you. I just wanted to please get the message out that the Opelousas Police Department continue to answer service calls throughout the city of Opelousas. We believe that our job is to be the first ones there and the last ones to leave. As it relates to reports that the public has continued to request, that we have established this morning an email, so if you need reports of any sort, you can receive those by emailing us at reports@opelousaspd.com. That is reports@opelousaspd.com. We're asking our officers to try to also, when answering calls, to try to keep a distance, but in the event of an emergency, they are actually doing their job and following the protocol that has already been established. We will continue to serve the people of Opelousas. We want to thank Dr. Stefanski for keeping us updated with all of the information that we need so we can make intelligent decisions. Our doors at the Opelousas Police Department remain locked from the public making contact with us, but they still can reach us at 948-2500, and also if it's an emergency, dial 911. Again, we are the first ones that are going to get there, and we want to be the last ones to leave to make sure that our city remains safe during this crisis. Thank you.
And just to add to that, there is very pertinent and up-to-date information if you dial 211. So if you're in the community and you need information on the coronavirus or what's happening, if you dial 211, you can get answers there. Again, parish government offices are closed except by telephone only. The courthouse is open, and we are allowing 25 people in the courthouse at a time. Clerk of Court's office is open, and I believe the Registrar of Voters' office is open as well. Parish permits and parish animal control are by appointment only. Is there any questions for Dr. Stefanski or
So, Dr. Stefanski, is the individual that tested positive here an inpatient or outpatient?
So, you know, we're very careful about what we release so that we don't disclose an individual's identity, but we will say this individual is not in an inpatient facility, is not in an inpatient facility.
Cassie Sherman, News 15. Did the patient show any signs of symptoms? Is that a reason to come into?
So, you know, I won't disclose any information, but I will say to clear up the issue of testing. So someone, the way that the test for this virus works is that you cannot be screened. So meaning if you have no symptoms and you're tested, at this point, you know, things are changing daily. At this point, the test does not work. It doesn't pick up if you're just if you're not symptomatic. So we're urging individuals, number one, the testing supplies are limited nationally. This is a national problem. We do not have the testing supplies that we need to test everyone who has fever, respiratory symptoms, and no other obvious cause. So so we would like to be able to do that, but again, testing supplies are limited. However, they seem to be increasing. That seems to be some light on the horizon. But the test result still takes, as you heard Representative Miller say, several days to come back. And I suspect as more and more people are testing, now that we have more testing supplies available, hopefully in the next couple of days, it may even take longer for test results to come back. So someone symptomatic at home and is otherwise healthy, and you're not able to be tested, you call your healthcare provider and they're not able to test you. The guidance is the same whether you're tested or not. Because if you're tested, we're not going to have a result for you right away. It's going to take several days. So what we tell people who have fever, respiratory symptoms, cough, short of breath, of course, if you're short of breath, Representative Miller would tell you that's something you might need to consider going to the emergency room. But if you have just a mild upper respiratory illness and a low-grade temp, call your healthcare provider. But you may be told, stay home, do what you normally do if you're healthy. And if it worsens, call back. However, if you have heart disease, diabetes, high blood pressure, those are the people that we want to test so that we know we can monitor because it seems that people who do become more ill usually do by about 7 or 8 days into the illness. So we really want to reserve those tests for people who are at high risk for more serious illness so we can help to guide their care. But the test is not a quick result test. Yes, and we still have, so Representative Miller makes a great point. He's also a healthcare provider. We're still seeing a lot of flu in this community, which is why providers are ruling out the flu. So if you have symptoms of the flu, cough, fever, and you call your healthcare provider, they will likely tell you to come in, test you for the flu, and if your flu test is negative, they may or may not test you for coronavirus or COVID-19 based on your high-risk group. You had a question?
Yes, Imam Boyd, KTC. Did the patient travel out of the country?
So we don't release any of that information. So that's all, we do very detailed contact investigations, but we don't release the information.
You were mentioning about the older group of 80 plus. Would you advise them not to go to grocery stores or not to, to stay in more during this time?
If they can. So people, especially who are older than 80, if you're able to stay home, it's best that you do. We know that isolation is awful, especially for older individuals. So we ask that people find other ways to communicate with your elderly family and neighbors. Call them. Have your kids call them. They're sitting at home. If they can video chat, do that. Offer to pick up their groceries, pharmacy, medications. Go to the pharmacy for them. But it's best if you can, especially if you're older than 80, and especially if you're older than 80 and have one of these underlying health problems like hypertension, diabetes, heart disease, lung disease, cancer. If you stay home if you can. But then that means that as a community, we need to help take care of them.
So you can't release any age range, whether they're in the city of Opelousas or another
No.
city?
Again, we won't release anything that might help to identify an individual. I think as a state, we're releasing numbers of ages across the board so that we can see where the cases are being diagnosed by age group in Louisiana.